Your child is not your partner in parenting.
Welcome to the ADHD Guys podcast with Mike McLeod of Grow Now ADHD and Ryan Wexelblatt of ADHD Dude. Learn about parenting kids with ADHD from two male licensed professionals who specialize in ADHD and executive functions. No fluffy parenting advice, only practical information that will help you help your child.
So what we tend to see where a lot of messages that parents are receiving is that when parents are asked to and told to take so much into account their parenting decisions, what their child is saying to them and what their child is expressing to them. So a lot of messages parents are receiving on social media and even by some, licensed professionals, they're being told that when you are making specific parenting decisions, you have to take into account your child's thoughts, feelings, concerns, negativity, complaints, all of those things to know what choices you should make for their overall quality of life and benefit.
And often, Mike, as we know, this leads to what I call the negotiation vortex, where parents are led to believe that everything with their child should be negotiated and that having, or stepping into their parental authority is not something they should do because it'll somehow damage their child. And I think, both of us have seen plenty of comments from parents who say things like, well, if I do that, he won't feel heard, or she'll shut down. And one of the things is that we're finding, for a lot of parents, they're losing sight of the fact that children need parents to lead them, as they have in every culture in the world for thousands and thousands of years. It is just this very recent phenomenon on social media where parents are believing that their child is their equal in parenting and they should have a say in everything. So one of the things we're going to talk about today is when it's okay to, ask for your child's feedback on something and when you need to step into your parental authority and say, this is what's happening. So I think a good place to start, Mike, is why don't you talk about some of the intake calls you get at the clinic when parents are a little resistant to, bringing their kids in for treatment, not because, of anything else, except they're worried about their kid's response.
Yeah, absolutely. So parents will always reach out to me directly when they are first intrigued and want to learn more about Grow Now Executive Functioning Services. So they'll give me a call and I'll speak to them directly myself. And I'll answer all of their questions to, help them feel comfortable and understand something that they may not know a lot about. And I answer all of their personal questions and what their concerns are and things like that. And one common concern that I pretty much hear on probably 95 to almost 100% of the calls is when parents start to express their concerns. Pretty much the number one concern is the parent will say, there is no way my child, my son, my daughter is going to agree to do this. So they'll basically just say, I know that my child needs some sort of executive functioning coaching. I know they need to work with someone to receive some sort of services to get some sort of support combined with the parent training, of course. But the parent gets so worked up and so concerned that the child is just going to put up a big fight and complain and have lots of noise and some really, big behaviors around having to do this. So the parent instantly thinks to themselves, my kid's not going to agree to do it. So there's no way I'm going to be able to get them the help that I know they need because they're just simply going to refuse.
Mike, one of the things before we go on, I think it's important to differentiate. I want to help people understand, why, for instance, I think that in the case of having, executive function treatment, that parents do need to step into their authority and make kids go. Whereas I don't think that kids should be made to go to, traditional talk therapy. Okay. And I wanted to explain the reasons why.
Definitely.
So if your child has ADHD, well, I believe ADHD is an executive function developmental delay, and they need help building these skills. Okay. Because if they don't build these skills, then they remain over-dependent on parents. And then what happens is they fall behind their same age peers in terms of not just their executive functioning, which is already delayed, but also their independence. And often this does not rear its ugly head until, as we know, Mike, kids go away to college and they don't make it through the first semester because their parents have been acting as their executive functioning for their whole life. We've both seen that plenty of times. The difference for me between this and, talk therapy is this, that talk therapy, number one, as we know, is not a recommended treatment for kids with ADHD, and no type of talk therapy has shown efficacy in addressing ADHD-related challenges. But the other thing I always tell parents is that, number one, in our culture, particularly right now, we are rushing to therapy way too much. I mean, any little complaint a kid has, rush to therapy. And I think a lot of parents feel that they need a therapist to make parenting decisions for them because they are so worried about damaging their child somehow and are seeking, expert advice. And, my response to that is, unfortunately, the number two source of misinformation I've seen conveyed about ADHD to parents after social media is from therapists, from mental health professionals.
Oh, absolutely. Yeah, and what I always explain to parents is the reason we prefer to work with the child directly is because that helps us to individualize the parent training along with some skill building and varied experiences and relationship building with the child. But in terms of this whole process of the child pushing back and having boredom and things like that, there's many mental health professionals out there now that are also providing parents this misinformation, where we're hearing lots of terms such as, masking and anxiety and trauma, and how parents are going to make things worse when they push their child into new and varied experiences or push them out of their comfort zone. And we just recently had an episode about how important it is to push your child out of the comfort zone. And we have licensed, really powerful therapists out there telling parents not to push their child because it will make things worse, because it will give them trauma, it will give them anxiety, it will negatively impact them. But we all know as adults who have been through childhood, been through adolescence, been through young adulthood and college and things like that, and the workforce, we all know that there's no growth in life if we don't leave the comfort zone. So why are licensed professionals telling parents that kids need to be comfortable all the time? I've even heard from parents that other mental health professionals tell them that the parents should give them more screens, give them screens. It regulates them. Let them stay home after school because they were masking all day and they're tired and things like that. It's so important that parents start to understand and go back to what the real longitudinal decades-long research tells us about authoritative parenting, experiences, relationships, and getting the kids out of the comfort zone to develop resiliency and real-life skills that actually improve quality of life.
Mike, I want to give a quick example of this because as you were talking, something came up this week when I met with a family. This was, a very, obviously a very attentive family, and they were sharing with me that their son, who is 9, kind of carries around an object that's almost like a security blanket for him, okay? It's not a security blanket, but something similar. And, and I said to them, he's 9. He's going to be in 5th grade next year. This is going to start being socially stigmatizing if it's not already. And they said it already has been. And I said, can I ask you why? And I'm not asking this with any judgment, but why has this gone on for this many years? And what they said to me was, well, the therapist told us to let him hold on to it because it's like a security blanket. And I explained to him, I said, developmentally at this age, a child who does not have any trauma like he does, who has 2 loving, very attentive parents, doesn't need to be carrying around a security blanket. It's not age appropriate, But Mike, I just wanted to go back to one thing real quick about why I want people to understand that, I don't think kids should be pushed to go to talk therapy. Aside from the fact it's not recommended, the other reason why is I always tell parents, look, someday if your child, maybe when they were a young adult or an adult, if they need therapy, we want them to not be resistant to going because they were forced to go when they were younger, okay? And, as a licensed mental health professional, I always say we don't want to toxify kids' relationship to therapy in case they do need it one day. And that's particularly for boys because most talk therapy is not boy friendly. So I just want to differentiate there, the difference between why we're saying, yes, if it's something like, executive function treatment or going to something like a summer camp or some kind of lesson that, yes, you should make your kids go, but don't force them to go to talk therapy.
So along with this, this decrease in this authoritative parenting style that we've seen over the past couple of years, in terms of child development, what so many parents don't seem to realize is that it's so incredibly typical, normal, common for kids to test limits and for kids to complain and for kids to make noise about things that they simply don't want to do. Neurotypical kids, all kids test limits and will complain about things because that's what they do. And they're going to do it most with their parents. So they're going to complain about having to do chores in the home and having a competent role in the home. But we know it's the best thing for kids to do. And there's tons of research that show that kids who have chores and competent roles in the home, it leads to progress and success and gains for decades long in life. So it's so incredibly normal and typical for kids to have this pushback. But now that there is information on social media from people that are, putting things out there simply for likes and clicks and retweets and follows, and professionals out there that are, kind of placating to this information, it's very important that we go back to really focusing on what really works, because this information about hurting your child and damaging them by pushing them out of their comfort zone really is, in the long term, damaging. So telling parents not to do that is damaging.
And, Mike, I have a saying that, kids are not fragile, they are anti-fragile.
Correct.
And I think a lot of people have lost sight of that. But as you were talking, it made me think of something I want to share with you. So when I was, I don't know, from whatever grade, I don't even remember, from probably fourth grade, okay, or third grade, I had to go to Hebrew school twice a week, okay? It was Thursdays and Sundays. Every single week I complained about it. Every single week was, I don't want to go, or making up that I suddenly got sick after school, And there was, my dad was like, he wouldn't even entertain it. There was no discussion about it, And did I like going? No, of course I didn't like going. Did it traumatize me? No. Did I make friends there? Yes. And actually, it particularly helped me when I went to a new school in middle school, because I already knew a lot of kids from Hebrew school there. But, to that point, there was no discussion and processing of feelings about whether I wanted to go to Hebrew school or not. Do you know what I mean? Just like every year before I went to overnight camp. And for those of you who don't know, it's a common thing in Jewish culture that kids start overnight camp pretty early.
Yeah.
And every year I would say, I don't want to go. And there was no discussion about it,
Absolutely.
Right. And I went and I had a good time. And did I love every minute? No, of course not. But when I look back, I am so grateful that, my parents did not, my parents did not negotiate everything with me, or they did not process my feelings about everything and just said, this is what you're doing, because that built resiliency. That's how I build resiliency.
Yeah, absolutely. And just to kind of follow along with that exact same theme, I've had the privilege over the past couple of years to go in and train several schools that are Jewish schools within the Jewish culture. And and you can correct me if I'm wrong, if I have the details wrong on this, but I believe it's like from sundown Friday till sunrise Sunday or something like that. There's no use.
Sundown Saturday night, but yeah. Mm-hmm.
Yeah. And what is that called again?
Shabbat.
Yeah, there you go. And there's no use of electricity during those times at all, correct? You don't use anything that involves electricity, or there's no screens.
Yeah, there's no using. This is in Orthodox Jewish families. Yeah, there's no using your phone. There's no turning things on. You're not supposed to do any work. Yeah.
There you go. And that's for the entire religion. And of course, there's individuals there that, have ADHD, that have, anxiety, trauma. It's an entire population here. But this has become an expectation. It's an expectation that's intertwined into the family unit, and it's become an expectation for all of them to follow it, because that's their culture and that's the values. And are the kids complaining about it? I'm sure they are, because so much of childhood now revolves around screens and those sorts of things. But it's something that I've loved to learn about, and I think it's a beautiful thing. Is it traumatizing kids? Absolutely not. Is it making them uncomfortable? Of course it is. But is it forcing them into other tasks? Are they probably learning other strengths and other talents because their preferred tasks are not available to them during that period of time? That's what it's all about. And, you see a million videos and information out there about how the ADHD brain is so creative. The ADHD brain can really, it's the entrepreneurs. The ADHD people become entrepreneurs and they think outside the box and all of that stuff. That's not going to happen if they're not uncomfortable and they're not exposed to boredom, and they're, if they're on their phone all the time, or YouTube or video games or things like that. If we push them out of their comfort zone, they'll be able to find some talents that could really make them employable. I just had a conversation yesterday with a parent, And that parent basically, opened up to me about how much money they've spent on their child who's now in 8th grade. They've spent probably close to $500,000 on therapies, private schools, all of those things. And they really don't have a lot of progress to show for it. And they got to the point where they were like, hey, do we really have to keep focusing on academics, and this standard set of life for this child? Or is it time to think about a trade school and putting them in more of a nature-based school and learning a trade and kind of getting them out of their comfort zone to learn actual things? That's only going to happen if we take sort of that authoritative approach, because we know what's best for our child. The ADHD brain and the lack of self-awareness and future thinking and all those sorts of things, it's hard for them to know what's best for them. We know what's best for them, so we as the parent have to persevere through the behaviors, the complaining, the noise, because we know what's best for them, and we know down the road they'll look back on it and they'll be happy they did it, just like you with Hebrew school.
Right. Although I mean, not that I ever liked 1 minute of it, but I'm glad I went.
Yeah, you're happy you went.
The other thing, Mike, I think a lot of parents have lost sight of the fact that, number one, I do think a lot of parents, we have to acknowledge, I think are very scared of their kids being upset with them. I think a lot of parents are scared of their kids rejecting them. I think a lot of believe that, if I upset my child too much, then they won't have a relationship with me when they're older. And I think one of the things a lot of parents have lost sight of is the fact that all feelings are temporary. So if your child's upset with you because you're telling them this is what we're doing, that doesn't mean that they're going to hold on to that forever. They will get over it. What I always say to kids is we're never happy forever. We're never sad forever. We're never angry forever. All feelings are temporary. We get over things. And I think that's an important thing that's being lost, as well as, the other thing I think is lost is just, for a lot of parents, is knowing that it's okay to say, I hear you don't want to go. That's okay. And this is what we're doing, and not getting into that whole, playing armchair therapist and processing feelings of why don't you want to go, and, over empathizing with them and over validating. And that doesn't do anything to help the child. Parents do it with the best of intentions, thinking, well, then they'll feel heard and then they'll understand my point of view and then they'll be okay with going. No, because again, the more you talk about it, right, the more you're focusing on these negative feelings instead of just letting it go.
Exactly. And at the end of the day, this is what kids are supposed to do. Kids are not mini adults. They are going to test limits. They have so few experiences and they don't have a fully developed brain yet. And, this is not just an ADHD behavior. Neurotypical kids do this as well. But of course, with ADHD, it will be amplified and those sorts of things and be more consistent and things like that. But kids are supposed to complain. They're supposed to want to do what they want to do all the time. And it's our job as adults to push them out of it. I mentioned earlier that part of ADHD is a disorder of self-awareness, which, some kids with ADHD can have a stronger level of self-awareness and some really struggle with it. And part of that issue with self-awareness is, obviously being able to perceive your environment and understand oneself and your effect on your environment and the people around you. But it's also really having difficulty understanding your own strengths and your own needs and understanding areas where you kind of need some support and you need help and you need to push yourself and you need to do different things aside from what you're doing every single day in a comfortable aspect. So many of us as adults know where we struggle, where we fall short, where we have to do better, whether it's diet, our relationships, exercise, things like that. The ADHD brain really struggles with that due to a level of decreased self-awareness. So us as the authoritative parents can help them develop that sense of self-awareness by pushing them out of their comfort zone, first allowing them to be uncomfortable, and then once they are able to persevere through that task and finish it, that feeling they have at the end of completing that non-preferred task, that feeling is stronger than any therapy they'll ever do in their adolescence.
And let's be clear, that doesn't mean they will be happy or like it necessarily, but the way kids develop confidence in themselves is through recognizing their abilities and understanding that they have the resiliency to persevere through something that's not interesting to them or something that was, initially uncomfortable because it was a new situation. That's how they build self-confidence, right? By recognizing I have the capability to do this. Kids do not develop self-confidence by adults giving them reassurance or telling them how great they are.
So we've spent a lot of time talking about therapy and really structured, adult-directed things like that. But what we need to really talk about in a bigger picture here is overall varied experiences. And this is what a lot of this most recent research is telling us, especially from really great groups like the Stanford Parenting Center and the Harvard Center of the Developing Child, is how incredibly important varied experiences are for the development of executive functions. Because we talked about in a previous episode how kids with ADHD want to stay within their comfort zone, but exposing them to varied things helps them to develop self-regulation, self-motivation, social executive functions, and things like that. So what I always tell parents is find different ways to utilize your community, see what's out there. It doesn't necessarily have to be going to a therapist's office and talking about your feelings.
Well,
let's look about, yeah, exactly. And let's look at what's out there. What are the after-school activities that are available for your child? And that's pretty much one of the easiest things, because you can contact the school and say, my son is not to get on the bus every Tuesday. I've signed him up for this group, or don't pick him up at a certain time at certain days. So they're pretty much forced to go and do it. Your child will probably say, no, I need to come home after school. I'm tired. I'm exhausted. I need to relax. And it's probably because they want to come home as soon as possible, where their Xbox is, their Switch is, their PlayStation, their gaming computer, their TV, and they can just relax and not be around people. And things like Instagram will tell you that, kids are holding it in all day at school and they have to come home and relax and decompress. But really what's best for these kids is sign them up for a sport. And you had a great video recently about the best sports for ADHD kids, and we can talk about that. Sign them up for a sport. They don't have to be super athletic. They can do individual sports. Chess club, debate club, robotics club, which a lot of ADHD kids do really well at. Even some schools now, which I'm not a big fan of these, but a lot of schools are doing like esports. It's better for them if they're going to play video games, at least do it in a room with a bunch of your classmates than in your basement at home. You know what I mean? Totally. So sign them up for something. Get them out there. It's like send them to the local YMCA, drop them off at the local library, do something where they're out of the house as much as possible. And yes, they're going to complain, but this is by far the best thing for them. And why is nobody else pushing this? Because if your child goes and plays at the playground or plays outside after school, no one's making money off of it. It's as simple as that. That's why so few people are talking about nature-based play and getting your kids outside, because no one profits off of kids being outside. But that is by far the most important thing.
Mike, one thing I was thinking about is it amazes me how many families I talk to that do not take advantage of the fact that their school offers after-school activities for free. Yep. And I say, why isn't, your son or daughter involved in them then? At least one. It's incredible to me. I mean,
and also how many families have full family YMCA memberships or local things just like that. And the fact that, I remember when I was in high school, 9th, 10th grade, and it wasn't like wrestling season or something like that, where I had nothing after school, I would get dropped off at the YMCA every day after school for hours. And it forced me to get to know the gym equipment, get some exercise, meet people there, hang out with people there. And that was just where I was dropped off and where I was put. And looking back on it, those are some of the best memories I have of my teenage years.
Mike, one of the other things I teach parents is that I strongly believe kids need to be connected to their community somehow. Okay. And whether it's doing an after school activity or whether it's doing, robotics club at the library where you live, they need to be doing something besides sitting in video games. And, and if a parent said to me, well, they don't have time for that because, we're going to OT one day and we're going to talk therapy the other day, the next day. I have said to parents when they've said that, stop it. Stop. Let them go and be, their same age peers doing, Lego club or doing parkour or whatever it is, because that is naturally how they're going to build executive function and social skills, not through, going to 50 different therapies a week.
Yeah, and you're going to save a lot of money as the parents doing that.
Yes.
Because 100%. And it's very beneficial to your child. And I'm sure some parents listening to this are thinking, all the behaviors they're going to have to deal with when they first sign their kids up. Once again, the authoritative parenting, just like you said earlier, I can see you're upset, but this is an expectation, not a choice. We're doing this. And then, of course, there's also the environmental accommodations where you're going to want to ask yourself, what is my child trying to do, instead of this thing that I signed them up for, like an after-school activity or a YMCA? So are they trying to sit in their room and play on their phone? Are they trying to be on their video game system? Are they trying to just be on the Chromebook or the laptop? If they are, TikTok. If they are, it is your responsibility as a parent to remove those things and not make them accessible. If you're the parent and you just leave it up to them and say, hey, I signed you up for karate on Monday, Wednesday, Friday, and then Monday comes around and the kid's playing a video game and says, I don't want to get off, I'm not going to karate today, it's your responsibility to unplug that machine and take the controllers away and make sure they follow through on that responsibility. You can't just say, oh, he was happy playing games, he was having a social experience playing online games with people. It's your responsibility to alter the environment because it is your house, your Wi-Fi, your electricity. You control that environment and you make sure they follow through on their expectations.
100%. So, Mike, before we get into our new segment, I think let's talk about some actionable strategies that people, can take away from this. So I think, number one, it's okay to acknowledge that your child doesn't want to do something, but that does not mean there needs to be a discussion about it or over-validating feelings or over-processing feelings, or playing armchair therapist and asking lots of why questions. Acknowledge how they feel and say, and this is what's happening. So that's
exactly
my takeaway. How about for you?
Yeah, and I think just to kind of piggyback off of that, what I think you say so well is one of your best quotes is be short and stay on message. It's as simple as that. So what a lot of parents are going to naturally want to do is go into a long monologue and a long lecture about why the kid needs to do this and why, what's happening. So the kid's probably going to use a lot of language because these ADHD kids are very good with their language to kind of convince people. So the kid's going to come at you with a lot of language and behaviors. It's your role as the parent to remain calm, make sure your facial expression is calm, your body language is calm, and do not respond to their lecture and their words and their behaviors with a lecture of your own. Respond with a simple 1-sentence, 2-sentence thing. I see you're acknowledge their feelings. I see you're upset, but this is an expectation, and we are going to do it.
So, Mike, in Scaffolding Better Behavior, I teach, the argument vortex, reasoning vortex, and negotiation vortex. And
there you go.
I think what we're talking about is this is where parents really get stuck in the negotiation vortex or the reasoning vortex. Like they want to reason with their kids because they want them to agree with them. And, I always say you can't reason with inflexibility. So don't try.
And remember, language makes dysregulation worse. So if your child's dysregulated and they're using lots of language at you, and a lot of times parents will hear their kids using really emotional and adult language and using really big words and sometimes
manipulation.
Yeah, exactly, and emotional manipulation, and parents will confuse that really advanced language with very strong emotions and something they have to really respond to and give lots of words to. And a lot of kids with ADHD have very good expressive language and can use really strong language, but it's very important that just remaining calm, looking calm, but being strong and staying to that point and not trying to reason with them and help them to see your point. Like you're probably not going to get to the point where the kid's going to say, you know what, Mom, you're right. I should do chess club. It's good for me. It's not going to happen. It's going to take a month or two of the kid going every single time because you made them as a parent to eventually it's going to be, hey, it's chess club time. Okay, I'm ready to go. And like 2 months later, they're already preparing for it because they enjoy it.
And even if they make noise like I did for years and years when I had to go to Hebrew school, it doesn't matter, right?
Correct.
Still go.
Correct.
So, yeah.
100%.
Right. So I think that's a great place to wrap up. So let's talk about our new segment we're introducing this week. We are introducing a new segment to the show called our Clutch and Cringe Video of the Week. And in this section, what we're going to do, in this segment, what we're going to do is we're going to share a video we saw on social media that we really liked. And that will be the clutch video, clutch meaning good. And we're also going to share a cringeworthy video, meaning a video that we felt, was shared misinformation or pseudoscience or just really bad advice. So just to clarify, when we do this, we are going to give credit where credit is due to the clutch video, but we are not going to name the name of the social media account where the cringe video came from because we're not trying to make an example out of anyone. We're just trying to help parents discern helpful information from not helpful information.
Absolutely. And Ryan and I have been very open and transparent about social media and what it has done to the world of ADHD and parenting and those sorts of things. So basically, if you're someone trying to gain followers, likes, and retweets and things like that on social media, if you talk about ADHD and you do hashtag ADHD, you're going to get a lot of views. So ADHD is a very, very popular thing on social media. I believe CNN just did a whole segment about the rise of ADHD on social media. So there's more ADHD influencers, quote unquote, that you can possibly count. And we live in a world now where followers, likes, and those sorts of things have replaced actual credentials. So there's a lot of people out there giving information on ADHD that is flat out wrong. And because parents are commenting on it, it's getting likes and they have followers, it's being taken as valid information and research. So it's very important for us to, have this segment and talk about it and be very open about what's out there. And hopefully you find it beneficial to understand, hey, this is just, entertainment. This is not something I need to take seriously when it comes to ADHD.
I think you're being too generous, Mike, by calling it entertainment.
Correct. It's garbage. It's garbage.
Okay. So let's start with the cringe video of the week, okay?
All right, let's do it.
Why don't you play it just so we have context for hearing it, and then, we'll send it to Nick so he has it.
So here is our first ever cringe video of the week. This is a man describing ADHD masking explained as the caption. So here it is.
You're okay the way you are, and there's certainly nothing wrong with that, and I appreciate that message, okay? But the cringy part is this talk about masking and how somebody with ADHD goes through their whole life masking and hiding who they are. And I think that's a really negative message for parents to hear, right? That your child is always going to have to hide who they are, right? And they're going to be on this negative trajectory because of their ADHD.
Yes. So one thing that we are definitely not saying or condoning is that kids with ADHD do not receive negative messages. So he talked about how kids with ADHD, they may hear things like, why are you so sensitive? Why aren't you normal? And they do get more negative feedback than the neurotypical peers. All of that is true. But this whole aspect of hearing that and then being able to change yourself, what happened to being impulsive? Let's think about what ADHD truly is for a second here. So ADHD is the ability to stop, think, hear information, or executive functioning is the ability to stop and think, hear information, and change what you would have done on impulse to go with a healthier and more positive choice. So basically what he's describing as masking is executive functioning. And ADHD is a disorder of executive functioning. And we all know, you go into a school and you're observing a classroom for an hour or two, you can kind of observe pretty quickly, which kids, may have executive functioning troubles or not. You're really not seeing too much masking there. Masking for adults with ADHD, older, that's could be something that, is more possible. But saying that, those 18 and below are masking their symptoms because of the negative feedback they're hearing, that requires pretty high level of executive functioning, situational awareness, self-awareness to be able to regulate yourself to a point where you're not being your true self. And then, let's also discuss, we're all different people depending on where we are. I talk differently to you than I talk to my wife and my child and my coworkers and things like that. So we're all different based on the environment, the people we're talking to. Everyone listening here, you're a different person with your family than you are with your coworkers and your friends. So are you masking, or do you just have the situational awareness to act a certain way around specific people?
And Mike, I think the other thing just we want to convey is that, not only is this term masking so overused, but it's also always used in this, negative way. And we all have to, quote, mask in life. That is part of learning to live within a culture, okay? And if you don't do that, well, then basically you're going to be sitting home unemployable, okay? If you don't learn how to live within the dominant culture. So that's what bothers me the most about this is this idea that, masking is this horrible negative thing and it keeps you from being who you are. And no, it's called adapting, right? And adapting, being flexible, that's an aspect of executive functioning, one of the core features of executive functioning.
Yeah. And today we talked about pushing your child out of their comfort zone. The amount of parents I've spoken to that have been told by mental health therapists that you shouldn't push your child out of their comfort zone because they were masking all day at school. You should let them come home and lay on the couch and be on their phones and be on video games because they're exhausted from masking all day. That's not valid information, and that's not helpful, and that's not giving parents real information that will help their child. So telling parents that their kids are holding it in all day, and when they come home, they should be able to scream at you and curse at you and have big behaviors and be on screens all day. That's not helpful information, and it's not based in research.
Right, exactly. And that's what I wanted to say, that so much, to finish this up, Mike, so much of this masking stuff we see on social media has no basis in research whatsoever.
Correct. Yeah. And there's, go ahead right now, go to Google Scholar and type in ADHD masking and those kinds of things. It's something that has been pushed on social media in many different ways. You see it used in different ways, and it's gotten a lot of attention. It's become sort of a social media phenomenon, this whole idea of masking. And it's you can almost call it sort of like fear mongering and giving parents more reasons to constantly be nervous about their child. We already have the 24-hour news cycle in this country that's constantly scaring parents to think that the outside world is too dangerous for them to go out and play. Now they have to worry about their kid masking all day. So it's just more to worry about.
Mike, I think that sums up for me why I think this video is, the cringe video of the week, because it's fear-mongering. That's the bottom line. Yeah.
Absolutely. 100%.
So let's get to the clutch video of the week. Who is this video from?
So this video, since it is the clutch video, we'll give them a great shout out because they are awesome. It is from Dr. Beach Gem 10. So this is a doctor describing three parenting rules they have in their house. So this is Dr. Beach Gem is a pediatric emergency doctor and mom of 4. That's what it says in the bio. And this is the video describing specific parenting rules that they have in their house.
We have 3 parenting rules that we live by in my house, and you did catch a glimpse in the Googly Eye video. The first one is no questions. If it is not a question, do not pose it as a question. Do you want to brush your teeth? Do you want to clean the kitchen? Do you want to put your shoes on? If them answering no is unacceptable, then it's not truly a question. Go brush your teeth, go clean the litter box, go put your shoes on. Number 2 is just keep it simple. If you're telling a child not to do something, give them a brief explanation, but they do not need a lecture. Their attention span is less than yours here on TikTok. Make it short and sweet. Number 3 is no emotions, and that means getting yourself in check, getting your emotions regulated before you approach the child with discipline. Emotional regulation is not something kids are born with. It is something that they are taught, and leading by example is really important. If you yell at your child when they do something wrong, they're likely to yell at their sibling or a friend when that person does something wrong. So we can teach regulation by taking some deep breaths and approaching the situation calmly without emotion. Our kids are worth it. It's about progress, not perfection.
So, Mike, my favorite part of that video, I think, is the first thing she says about, right? If something's not a question, right, don't ask it. So, instead of saying, can you put your shoes on? Just put your shoes on, right?
Correct.
And when parents ask things as questions, sometimes that should be, a command, that is not helpful to kids, because what it's saying to them is that, I'm going to ask you nicely to do this, but, you don't really have to do this. It's kind of up to you.
Yeah, I would say what I love so much about that video is she did such a great job, and we'll link it in the show notes and put the information there. She did such a great job describing very simple rules in a very simple to understand way. And basically, what she was saying there was certain things in an authoritative parent house are an expectation and not a choice. So don't ask your child to do something. It's an expectation for them to do it and for them to do it now. So present it in that very specific way.
My other thing I really liked is she brought up what I call affective calmness. So the idea that you present your calm even when you don't feel calm inside. And I think the most important thing she said there is that if a parent approaches their child, in a way where they're emotionally dysregulated, it might not be tomorrow, it might not be next week, but eventually your child is going to model that, as she said, with their siblings or with their friends. And I think that's a really important thing for parents of kids with ADHD to hear, that your child will model your emotional dysregulation with other people or with your other children.
And that's so incredibly important for parents to understand. Everything she described in that video were facets of authoritative parenting. And she made it a point to say the parents have to keep their emotions in check, especially when they're about to handle some sort of discipline with a child. So that's what parents have to understand, and every single listener of this show has to understand. When it comes to authoritative parenting, it's not authoritarian, where you are yelling at the child and having very strict rules. Authoritative is where you are modeling calmness as much as possible. There is no yelling. The parent is regulated and modeling calmness, and there's open communication and natural consequences, and that's what she's talking about. So nobody is telling you to be authoritarian. It's authoritative and modeling calmness at all times.
And I'm glad you brought that up, Mike, because that's something I find people get confused a lot about. They get confused between the terms authoritarian and authoritative. So thanks for
Yeah.
All right. I think we're going to finish up. Anything else for today, Mike?
So far, you and I have released a nice amount of episodes. We had our debut yesterday, so 5 episodes debuted, and I think it's great to give a little bit of a shout out to everyone who personally messaged myself and Ryan congratulating us on the first 5 episodes, and everyone who subscribed and liked and reviewed. So now that the episodes are out there, and we had our launch day yesterday on March 13th, 2024, it's great to start to build this ADHD Guys community, and to hear the people that are listening and being helped by this and are listening to it, on the treadmill or in the car or wherever. So everyone that's reached out and congratulated us and are becoming a part of this podcast, obviously we're doing this for you guys. This is all about you guys and, getting real information out there. So everyone who reached out, we want to give you a big shout out and a thank you.
And thank you, everyone, for all your enthusiasm about this as well. It was really great to see that so many people were excited about this. So thank you. We really appreciate it.
Absolutely. Thank you guys so much.
We'll talk to you soon. Take care.
Take care.
Thanks for listening. To learn more about Mike's practice, Grow Now ADHD, please visit his website at grownowadhd.com. To learn about the services Ryan provides, please visit adhddude.com. You can find Mike on Instagram at GrowNowADHD, and you can find Ryan at the ADHD Dude YouTube channel. The ADHD Guys podcast and content posted by either Grow Now ADHD or ADHD Dude is presented solely for general informational and educational purposes. The use of information on this podcast is not intended as a substitute for the advice of a physician, professional coach, licensed mental health professional, or other qualified professional, diagnosis, or treatment. Listeners should not disregard or delay in obtaining professional advice for any medical or mental health condition they or their child may have, and should seek the assistance of their healthcare professionals for any such conditions.